Okay, so Dr. Michael Jarman, Pediatric Foot and Ankle. We're going to do a HyProCure removal today on a real patient. This patient had HyProCures placed in probably, we'll say 6 months ago, and is not doing well. I did not have the privilege of putting these in, but that's the unfortunate event is that not all of these are successful. On the screen here, we've taken an x-ray, and we can show you what that looks like. We're going to pan around over there. So the position of the HyProCure is actually ideal, it's just not being tolerated. So we're going to go through this, and I'm going to show you how actually easy these are to remove. And we're going to remove out both. So we're going to start with this foot here. In doing this, we have the skin marker. We're going to go through the same incision site that was used prior.
9, 1.
So the sinus tarsus is right here. I'm marking my landmarks, and I'm going to put a small incision about right here. There's 2 instruments that we're going to utilize to make these come out when I pick it. And that's an extractor and a laminar spreader. Can I come up on the table a little bit? That's good. Give me a nut. Okay, we have anatomy scissors. So it didn't go deep, nothing stabbed deep. Anatomy scissors, I'm just gonna open this up. I'm gonna go all the way down to the sinus tarsi. Okay. Just like this. And I have the laminar spreader. I like the laminar spreader. This is just to give visualization. This is smooth, no teeth. And I'll open that up. And then let me have a free. Good. Flip this around. Oh, I'm going to have you. Okay. And we're going to use this. This is like a tooth distractor here. It's got a long beak on it. You could use a rongeur. Let me see. A small rongeur would also be acceptable. So you're just going to grab it and we're going to spin it. The threads on it don't matter. The threads actually are not catching on anything. But I can actually let's see, it's right there. Okay. I'm going to take the laminar spreader, so I'm on it, and I'm going to take it and I'm going to spin it. I think it popped off. Yeah. No, still on it. So I'm just going to spin it. There we go. And now as I spin it, I'm going to give it a slight pull. As I spin it, and there it is, right? Putting it in takes about the same time, but obviously taking it out pretty fast here. Now, I've done a lot of these, and that technique works very, very, very well. You notice I didn't have an x-ray in here where there's no exploring, just grab it. There is a pocket right here, and I'm basically just grabbing it just like this. But you have to spin it. You can't just grab it and pull it straight out. So now I'm going to close this up. This is very non-traumatic as well in removing them. My incision here is right over the sinus tarsi. Maybe it's 2 to 3 centimeters. I'm going to just drop. All this will heal right back up. I'm just going to drop one suture. I'm using 4/0 Vicryl.
Would you like a monochrome for scan? Or not?
Yes, I like the 5/0 monochrome. Just hold that together. So when I take these out, the patient is able to walk immediately on it. So they're not put in a boot. I'm not restricting them. I'm just going to put a soft dressing at the end of this, and they can walk today, and they'll leave that dressing on for about 4 days. I'm going to use monocryl, and the patient can take, there's no sutures that are going to need to be removed with this. And the patient's able to take them off for themselves. All 5 and hold that.
Hey, I'm gonna need some rocuronium for
No
this.
problem.
Very strips and masks as well. So now I'm going to put some steri strips and Nasazole on these. That's it. All right. All right, so now we're going to come over this other foot. And actually, let me put the wrap on this one. So I'll drop it right there.
I got you 2 drops as a TSA for giggles.
Okay. Close it up. I'm going to put a little bit of iodine on here. I'm going to put a Curlex and a Coban, light Coban, and that's it. Then we'll drop tourniquet, and then we'll inflate tourniquet over here. Touch this. Okay, tourniquet down.
It's coming down. 9 minutes. Here. That was 14:52.
Pick it up on the left.
1453.
Oh, it's so slippery.
You can see that in there. Seated just fine. Wherever it's supposed to be. And it appears radiographically they're very deep, but they're really not. Okay, landmarks again for my incision is distal fibula,
And the last patient might have.
anterior horn of the calcaneus.
I'm gonna go out there and give him some
And,
oral
okay.
to really get out.
You're good.
I'm actually gonna sit it up.
I've already have it drawn out. What's that?
No.
Yeah, I already have it drawn up, otherwise I would. Can you remind me start time?
Yeah, 1443.
What did you say that show is called Monsters? I don't know if I dare watch that.
Let's do this. I have a small round jaw.
It's really, it's like.
Just to show you, I'm going to use a small rongeur to remove this versus a specialized tool, but it has to be small to get down in there. Okay, pick that up. Just do a small twist. There it is. Let's see what size is that. That looks like probably a 5 or 6. It's a 5. So again, I'm grabbing the inside rim. I use the rongeur to visualize. If I visualize it, it's so easy to find versus blindly trying to use X-ray to find it. So now,
There again?
and it's gone. And the foot line up there. Perfect. Okay, for a Vicro.
Pretext, I have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. I have 1, 2 sutures, 2 blades, and a hypodermic needle. 1 bogey tube.
That's correct.
Can we get another Massasol, please? Appreciate it. So,
You could say that. Why do you have to be that's their main character?
yeah,
No?
Again, 5-0 monochrome being used, because this will just absolve, and then I'm not needing to remove sutures in a week or two. These will just absorb by themselves.
freshie.
Okay, so as we wrap these up, really love HyProCures. They're a great product. I use them a lot. The success is very high, but we do have patients that obviously they have to be removed. What we find with HyProCures is that it's just inconvenient. For myself, who installs these or places these implants in patients regularly, it's about a 15-minute procedure, and removal is probably about the same. It's just inconvenient when they have to be removed, but it is a reversible procedure for a pediatric flatfoot, which makes it a great alternative to a traditional flatfoot surgery.